Hello YouTube, welcome to Dr. Vibes The Learning Point. In this video, we'll study about rheumatoid arthritis, but please subscribe to the channel. In this video, we will study about RA, that is rheumatoid arthritis. So what is rheumatoid arthritis? It is a chronic inflammatory disorders involving the joints of unknown cause and having multi-system involvement. This is the definition. Now, the epidemiology. It is more common in females than in males because it is an autoimmune disease, and we have seen that autoimmune diseases are more common in females. And it can occur at any age, but the more peak occurs at 40 to 60 years of age. What is the etiopathogenesis? So there are many genetic and environmental factors which predispose to rheumatoid arthritis. This will cause an immune response in the body against the proteins which are already present in the body. So this is an autoimmune response. Now, as any immune response will cause inflammation and tissue damage, so this autoimmune response in the body against the ACPA, rheumatoid factor, TNF alpha, interleukins 1, which I've mentioned here, this will cause inflammation and tissue damage. Now let's come to the clinical features. What will the patient present you with? So the patient will have pain. Chief complaint will be pain in the joints or swelling in the joints, deformity of the joints. So there are two important things which you have to know. You have to know about the hand deformities and you have to know about the extra articular manifestations. So first we come to the hand deformities. Hand is the most common site of development of deformities. Why is this so? This is because there is destruction of the joint capsule, there is destruction of the tendon, there is destruction of the articular cartilage, and synovitis can also occur. So destruction of the joint capsule, tendon, and articular cartilage. Now, the metacarpopharyngeal joints is affected early and the interpharyngeal joint is affected late. So this is a finger. These are the interpharyngeal joints, this thing, this one. So these are affected early. So these are affected late. And this one, metacarpopharyngeal joint, this one, these joints which I'm folding now, these occur early. So ये पहले आता है body में, ये पहले affected होगा. Interpharyngeal joints बाद में affected होंगे. Okay. Now we will see these deformities in a bit details. So you can divide your hands into fingers, into thumb, wrist, and the whole hand. So what will happen to the fingers? This is called as intrinsic plus. ऐसे होता है. This is intrinsic plus. So you can see that there is extension of the proximal interpharyngeal joints. There is flexion of the metacarpopharyngeal joint. Can you see this flexion? And there is adducted thumb. So extension of the PIP, flexion of the MCP joint, and adducted thumb. Now you have the swan neck. Now this is the metacarpopharyngeal joint, this is the distal interpharyngeal joint, this is the proximal interpharyngeal joint. So there will be flexion of the, I can't make it, but you can see it in the Google. There will be flexion of the PIP, there will be extension of the DIP. I'm so sorry. So basically this is the metacarpopharyngeal joint, this is the PIP, this is the DIP, proximal distal. तो distal वाले का flexion होगा, PIP का extension होगा, and this is always in the flex position. So this is swan neck. Buttonhole में क्या होता है? MCP will be flexion, DIP का extension होगा और PIP का flexion होगा. Just opposite. Swan neck and buttonhole is opposite. Swan neck में DIP का flexion होता है. ठीक है? I can make this, but this is flexion, this is extension, and this is flexion. Buttonhole में इसको तो flexion ही fix करो, इसका extension होगा and PIP का flexion होगा. And then there is ulnar deviation which will occur at the wrist. So you can just have a look here. What will happen in the thumb? Gamekeeper's thumb. It will be like this. So there will be problem in the pincer grasp and there will be instability of the metacarpopharyngeal joint. इस joint का instability होगा and there will be immature pincer grasp. What will happen in the wrist? Wrist में there will be carpal tunnel syndrome. That means there is a compression of the medial nerve. In the whole hand, there will be opera glass hand, boxing glove, and Z deformity. Now, opera glass hand मतलब hands पूरा छोटा हो गया है, fingers पूरा छोटा हो गया है. Okay, there is loss of the terminal phalanges, and there is the shortening of the fingers. The shortening of the fingers, destruction of the phalanx. Boxing glove में पूरा ये swollen हो जाता है, जैसे boxes का जो gloves होता है, जैसे swollen हो जाता है. So there will be swollen of the whole hand with the pitting edema of the dorsum of the hand. I will share you the images, then you can have a look. And in the Z deformity, you will see that there is ulnar deviation of the fingers and there is radial deviation of the wrist with palmar subluxation. So these are the hand deformities that you see in case of rheumatoid arthritis. Now we move on to the extra articular manifestations. So all the systems of your body from top to bottom are involved. सबसे ऊपर में क्या होता है? Brain होता है. So neural system is involved. So neural system में you have cardiovascular accident due to CNS vasculitis, and you have the carpal and the tarsal tunnel syndrome. उसके बाद क्या आएगा? ब्रेन के बाद आइज, यू हैव स्क्लेराइटिस, यू हैव एपिस्क्लेराइटिस, यू हैव केराटोकंजंक्टिवाइटिस. आइज के बाद क्या आएगा? नीचे लंग्स में आ जाओ, यू हैव प्लूराइटिस, यू हैव प्लूरल एफ्यूजन, यू हैव इंटरस्टिशियल लंग डिजीज. उसके बाद हार्ट में आ जाओ, यू हैव मायोकार्डाइटिस, पेरिकार्डाइटिस, इश्चमिक हार्ट डिजीज, वैल्वुलर हार्ट डिजीज. उसके बाद नीचे किडनी में आ जाओ, सो किडनी में यू हैव ग्लोमेरुलोनेफ्राइटिस. ठीक है, फिर आ जाओ मस्कुलोस्केलेटल, वेयर यू हैव ऑस्टियोपोरोसिस. देन एक कंप्लीट बॉडी में क्या होता है? हेमेटोलॉजिकल होता है, तो मतलब एनीमिया होगा, थ्रोम्बोसाइटोसिस होगा, ल्यूकोपीनिया होगा. And you have skin manifestations में you have Raynaud's phenomenon, you have rheumatoid nodules. So these are the extra articular manifestations of rheumatoid arthritis, which is very very important topic. Now how will you do the diagnosis of rheumatoid arthritis? तो पहला कोई भी disease के लिए you have to do a routine blood investigations. So what are the positive findings that you will find for routine investigations here? You will see that there is hemoglobin deficit, there is neutropenia, there is leukopenia, and there is thrombocytosis. मतलब platelets increase होगा. So you will do the routine investigations. Okay. You will also do certain serological parameters which are specific to rheumatoid arthritis. That you will see the amount of rheumatoid factor and the anticyclic citrulinated protein antibodies. Okay. Then you have to see the acute phase reactants, ESR or CRP, जो कि rise करेगा. You will also do the synovial fluid testing. More than 2000 cells is considered positive for rheumatoid arthritis. And you will also do, now rheumatoid arthritis is a problem of the joints, so you will do the X-ray and you will see symmetrical involvement of both the joints and loss of joint space. Now I will give you the diagnostic criteria of rheumatoid arthritis on the basis of these parameters only. Now as I told you that there are 4 criteria: serological parameters, acute phase reactants, you have the joint involvement, and you also take into consideration the duration of arthritis. Okay, so these are the points that I have told you in the diagnosis, that is joint involvement, acute phase reactants, serological parameters, that is RA and ACPA, and you have duration as well. So consider joint involvement. So if there is involvement of one large joint, now what do I mean by large joint? That is your ankle joint, your knee joint, your hip joint. So if the involvement of one large joint, you give it a score of 0. If there is 2 to 10 large joint, you give it a score of 1. If there is 1 to 3 small joints, that is your metacarpopharyngeal joints, it is your interpharyngeal joints, you give it a score of 2. 4 to 10 small joints, you give it a score of 3. And if you have more than 10 joints involving the both small and large joints, you give it a score of 5. So 0 to 5 is the score. Similarly, negative RF and APCA, you give it a score of 0. Low positive, you give it a score of 2. And high positive, you give it a score of 3. Then your normal ESR, normal CRP 0. Elevated ESR, elevated CRP, you give a score of 1. If duration is less than 6 weeks, 0. More than equal to 6 weeks, that is equal to 1. So you total the score. If it is more than equal to 6 weeks, that means there is rheumatoid arthritis having joint involvement. Okay, there is rheumatoid arthritis. This is the diagnostic criteria. Now, what is the treatment? The treatment of rheumatoid arthritis is, one is the symptomatic relief. You do it by using NSAIDs, and you have drugs that slow down the progression of the disease, that is called as the NMARDs. That is the DMARDs, which is the disease-modifying anti-rheumatoid drugs, in which you have the non-biological drugs and you have the biological drugs. Non-biological drugs, methotrexate is the drug of choice, and in biological agents you have infliximab and adalimumab, which is the TNF-alpha inhibitor, and you have the anakinra, which is the interleukin-1 antagonist. Now, from here you can just learn the drugs and the doses. Now, how does methotrexate act? Methotrexate acts by inhibiting the cytokinin release, the chemokine release, and the cell-mediated immunity, and this is the doses of the drug which is given. So this is all about the rheumatoid arthritis, and the prognosis of this disease is good if the treatment starts early, but this is a lifelong treatment that a patient of rheumatoid arthritis has to continue.